the new laparoscopic equipment that we were able to receive, thanks to philanthropic dollars, allows us to do minimally invasive surgery across many different disciplines in surgery, from general surgery, bariatric surgery, colorectal surgery, even gynecological and urological surgery. For many years, I would say about 10 years, we've noticed that there's a real need to have better visualization during these complicated surgeries in the abdominal cavity and the pelvic cavity. And having this new equipment allows us to get a much more detailed look of the different tissue planes and the anatomy of the patient. The new equipment consists of 3 pieces. You have the screens in the room, and as you can tell, they're very, very high definition and very large, so you can get a broader view of what's going on inside the abdominal cavity. You also have this processor, which is the intelligence for the whole setup. And the third piece is the actual camera that the surgeon or the assistant to the surgeon will control. You can actually zoom in and improve the quality of the image. And you can also zoom in and zoom out for those really difficult places to reach during surgery. You can already see that there is a crisp, clear definition of all of the things that you want to look at. And it allows you to change the horizon of what you're looking at during surgery. It allows you to focus with a touch of a finger. It allows us to do very small incisions that benefits the patients in a number of ways. They have less pain, so they require less narcotics, which results in them being able to tolerate a diet and be able to go home sooner. And so it also decreases the length of time that they're in the hospital. And overall, it's less of an insult to their physiology and just less of an impact on their quality of life after surgery.
One of the new pieces of equipment we've gotten is the tools to do a procedure called laparoscopic common bile duct exploration, which is basically a procedure that we can clear stones from the bile duct at the same time as surgery for a gallbladder. The other week we had a patient that came in and was having their gallbladder taken out by one of my partners, and they found that there were stones in the common bile duct. We were able to, using the new equipment we have, pretty easily get those stones cleared from her bile duct at the same time as her gallbladder was taken out, all in the same surgery, and go home within a couple of days. And the patient was very appreciative for that, and she was very grateful, expressed her appreciation for being able to stay here at this hospital and stay in the community.
One of the things that we've been focusing on is keeping all of our patients that come through the ER in our network. Now the patients know that they can get their care at home with surgeons they already know most of the time and not have to feel like they're going to be transferred out. We want to be able to provide the most cutting edge quality care to patients near their home. The amount of money that comes in is less and less, especially in a rural community like Bassett is in Cooperstown. So if it wasn't for people's benevolence or their willing to contribute to these things, we would see a long delay between getting these very important pieces of equipment.